This is an official Landbot podcast.
Hi everyone, this is Chris from Landbot, and we are today with another customer story. And today is a very special one, and you'll understand why in just a minute. So we are today with Diego Nievas, the CEO and co-founder of KumanuCare. Hi, Diego.
Hi, Chris. Thank you for having me.
It's a pleasure. So we'd like to start with a little bit of background of your personal profile and also KumanuCare. So if you can tell us a bit more about you and about what you do at KumanuCare.
Yeah, absolutely. So my personal background is not really that extensive. I've been working in technology for many years, since I can remember, really, since I was about 19 years old. And I sort of define myself as a curious mind more than anything else. I always try to solve, the challenges that I see around me. Because of that is that I always try to study or understand newer technologies and how those technologies can drive human progress. And if I fast forward up until when we started the Kumanu initiative, in 2012, my daughter was diagnosed with type 1 diabetes. And was back then that we realized or that we found very quickly that there was many challenges that not only for diabetes, but many other chronic illnesses would need help and aid from technology. And as the years went by, technology did come to the aid with different things around, meters and hardware to work out blood glucose levels and things like that for diabetics. But I was always found that there was a question that always revolved around in my mind around the fact that acquiring information for any chronic illness is always a challenge. I keep saying that it feels like drinking from a fire hose, and that's because so the minute that imagine yourself in the situation, right? So you get diagnosed with something that you don't understand. Doctors will explain it to you as best as they can, and don't get me wrong, doctors are great. But the reality is that there's something that we call the forgetting curve, and it's a reality that about a week after someone explains something to you, if you don't use it or if you don't live by it, 70% of that knowledge is gone. So based on that premise, is that we started thinking that there got to be a better way to acquire that information, and there has to be a better way of understanding the needs of the end user, in this case either the patient or the caregivers, right? And we did some study and we realized that people would lean towards either Facebook groups or Google searches. Unfortunately, the overload of information and things like that. So we started toying with the idea of using natural language processing and natural language understanding to sort of collate information and try to provide answers to people with chronic illnesses. And that's how the whole Kumanu dream was born, basically to bring information in a way that today it's not brought to caregivers or patients, which is basically intuitively and conversationally. That's in a nutshell what we're trying to do. Bit of a long explanation, though.
No, but it's super interesting. I think we all got some close cases of friends or family that has these kind of illness, and yeah, the situation is always pretty dramatic. And just like you said it's like a bunch of information at the very beginning. If you try to go to the source, it's probably number one rule, like don't Google an illness, right? Because it's what you're gonna find is probably not even worth it for you, and it's gonna probably be worse if you read it. So I think it's a great initiative. What you have. You wanted to say something?
I've did. Yeah, I was gonna say I always try to be super cautious about this, but the reality is that You go onto Google and you search any condition. You can search for my knee hurts, and it will say you'll die tomorrow or the day after.
Exactly. Yeah.
And it's amazing. It's amazing how, and I don't think it's anybody's fault, right? It's just an engine crawling through information trying to understand what you're asking. And that's exactly the point. NLP, natural language processing and understanding, would allow us to sort of find the information that is actually useful for the people that actually needs it, right?
Yeah, trying to like contextualize the information you're receiving. Yeah, I think it's super important. And all right, so yeah, that's a great initiative starting out in 2012. And how your service evolved. Like you started with this idea of creating technology based NLP NLU based services or products to help patients with dealing with these illnesses. And what's the experience like for these past 8 years? So where do you started and until you started looking for a solution like Landbot to solve that problem?
Yeah. So as you may imagine, the journey is always long, and it's always a weird path. I started even fiddling with glucose meters to see if there was any way that I could connect that onto some sort of platform that could. This was way before cloud was even a thing, and before constant glucose monitors were there. Today, all of that is around that. But I started in that path, and at some point, my co-founder Max Janesini we both came to the realization that the one thing that wasn't there is the feel for people, for them to feel heard, for them to feel that they are having a conversation with someone. So the journey evolved from, we need to do something about finding information, aka I frequently ask questions webpage where people can just go and trust the content there. Market wise, that is quite a silly idea, because as you may imagine, there's a gazillion diabetes web pages out there.
Yeah.
And so we started thinking about what else can we do? What else can we, or how else can we evolve this? And we started evaluating different platforms. At that point, we realized that for good or for bad, there's really two or three big hyperscalers that can provide the natural language processing power that we needed as a startup, without the humongous investment that you would need in data scientists and data acquire just to get to that point. So it's always, we had to leverage something. We made our call to use Dialogflow for natural language understanding and to parse the questions that the people might be asking, the patients and end users might be asking. But we were presented with the problem or the challenge of having to have a front end for that. And that was about maybe a year ago. Yeah, maybe a year ago. Up until then, we were using Dialogflow very statically, and we were able to just answer the questions and collate the information. But it always felt clunky, and it felt that there was something missing, kind of in the middle. And that was when Max, my co-founder, thought that the best next step was to find either a off-the-shelf front end that we could use or build it ourselves. We did try building some things ourselves, but the maintenance alone of keeping something like that running would cripple us in terms of the funding that we would need. We started evaluating different types of front-end solutions and different solutions that would allow us to be that glue that we needed between the different different moving parts of the solution. So at that point, again, we evaluated a lot of them, and we came across a Landbot, and we started using it as a trial type of thing. We said, well, we're going to try 3 or 4. I'm not going to name the others, though. Um, but what struck us as something that we had never thought before, and I think is brilliant on your side, is that everybody market themselves as no code bot creator or whatever marketing name you want to use. And of all the ones that we tried, I'm not going to say that that's not true, but it's not true to its essence, right? So there's some point where you, one way or another, you need to have a developer sitting next to you to solve one or two hurdles that you may find in the way. So with that in mind, when we started seeing how Landbot was simple to use for people who are non-coders, so I don't have a coding background, and neither Max. So we realized very quickly that we could start plugging into different building blocks to create what we wanted to create. So let me give you an example. So when we around, I want to say December last year, January this year, we started toying with the idea of having some extra features, some very, very important extra features. So in diabetes, as you and some of the listeners will know, it's very important to know how many carbohydrates you consume, because that's what changes the blood glucose levels in your body. So from the very beginning, we always wanted to have something that was that would talk to that idea, and with Dialogflow alone, it would take us. Well, we did a few quotes and a few assessments, and it was something around a month of trial and error development, right? When we discovered Landbot and we started actually using it, we realized that there's webhooks and API connectors that we could use straight out of the box. We really didn't need any any coding experience, and believe me, I don't have any. It was just simple as this is the API that we want to use, and this is the connectors that we want to use, and this is how we are going to do it. And it allowed us to get the time to value, as we call it, or the time to market, to be reduced from what it would have taken us, say, 2 or 3 weeks, all the way down to we created a small clickable prototype in 24 hours. So that's massive. So to quantify that in hours and in funding that we would need for a month of a couple of developers and maybe someone to plug into the API and whatnot, we calculated over $20,000 to $25,000 of investment that we would have needed to only that piece of feature that we needed. With Landbot, I did it myself, sitting on my computer in just a couple of hours. So that to me is just not only valuable, but also allows us. I think the big thing around all of this is the help that caregivers might get when they see the tool.
Yeah, that's a very, very impressive metric, like going down from 2-3 weeks to just 24 hours. And I love what you mentioned about being a truly no code solution. Yeah, I think it's a very trendy topic right now. Like everybody wants to label themselves as a no code solution. And the reality is that, yeah, like you said, most of them are not really that no code. I think that the big difference with Lanebot, or what we're trying to do, is if you're a true no coder, you're going to get the most out of the product. Obviously, if you're a coder, you're going to take like an extra 20 or 50 or 100%, but it's not even necessary. Like, I don't have a technical background either, and I remember the first time I set up a webhook or I play with arrays or things like this that 3-4 months ago it seemed impossible to understand for me, but you understand that it's super easy to build with Landbot, and that everything is pluggable, and that if you don't know how to build something, maybe you can reuse something that someone else has built. And I think that's very, very powerful. And yeah, when it comes to timing, we got a lot of customers that use Landbot for that reason. Even for prototyping, maybe you're not even building the final product, but the prototyping phase itself, it's super costly and it takes a lot of time, and tools like Landbot can help to build something that's really, really, really close to the go-to-market stage, but at the same time gives you the full flexibility to move back and forth, to make changes, to iterate it constantly. Like if it takes you 24 hours to build, that means that you get a lot of time to iterate. And if it takes 2-3 weeks, probably every single iteration is going to take longer, and that's an exponential timing graph. So I don't know what your experience with iterating your own flows in Lanebot are you, because we always recommend that, like, you build something, you test it with your audience, and then you keep iterating it. Like, what's your experience with from what you built on day one to what it become later, one of your creations with Lanebot?
Oh, that's a great question. I wish I could show you. So we started with just a couple of buttons that you could click, and it would drive the conversation towards places, as a lot of people do. Now, going back a little bit to the no coding thing, there's an element there, and I think you're quite right when you say if you are a coder, you're going to get a lot more value out of it, because there are hidden things in that realm that I don't fully understand. However, in saying that, the little bit that I could, first of all, the support that I would need, it's always there. So that's point number one. So every time I had a silly question about, hey, how do I pull this data from this intent in Dialogflow, there's always someone there to answer that question. Let's clear that. But aside from that, knowing those 2 or 3 little things and details that would allow you to take it that extra mile is huge. So, and I'll give you another example and we'll talk about the iteration as well. So at the beginning, it was quite static. So we found that we would get a landing bot that would ask you a couple of questions and then throw you right into Dialogflow, and then Dialogflow will sort of manage the whole conversation. As you know, conversationally speaking, that's not ideal, because the end user not always know, or they don't really know exactly what's the conversation they want to have. You can just say, ask me anything, because they will literally don't know what to ask. Now, the ability that we have with Landbot is to, without writing a single line of code, or maybe one line of code, saying to Dialogflow, if the user is asking you A, pass that back to Landbot. Landbot will understand that, and it will take you out of the flow from Dialogflow, and it will take you to this bespoke flow in Landbot that allows me to give you different way of seeing images, or lists of things, or I can parse HTML code and things like that. Or I can use a webhook way easier than I would use it in Dialogflow. That alone, back to your iteration question, when we started seeing around how to use the Dialogflow integration, and then we decided to do the carbohydrate thing that I was telling you. And I feel like I need to make a parenthesis here, because it's a very important information. This all happened during COVID, which means the COVID lockdown. Because maybe someone will listen to this in 20 years, and they need to know that we're all in our houses, people. We're not allowed to leave.
Exactly.
And the thing is that, it allows us to do that without the need of being in an office and all of that you would need if you're iterating a product, and you need to brainstorm and all of that. But aside from that, we started toying with that idea. We came to you guys and we said, we're building as well a COVID bot, and you were amazing in giving us subscription for a while, so we could really work it out and get all the features that we needed without having to have the capital expenditure that we would need. But aside from all of that, we went from the carbohydrate idea in I think it was 4 weeks ago, from the idea all the way to today, a working prototype where you can take a photo of the food that you're eating. It will call an API from Watson that will recognize the food. It will talk to another API that will tell you how many carbohydrates you're eating, and it will serve it back to the customer or to the user saying, this is the amount of carbohydrates that you're probably eating with that food. All
Wow.
of that in just a couple of weeks. And that's huge. That the ability to iterate like that, to go from ideation to 100,000 miles an hour, really cool prototype using cutting edge technology in a couple of weeks. It's fascinating, and we wouldn't have been able to do it without a solution that allows us to do that, not only non-coding, but also we can just duplicate one of the bots, just try it out, doesn't work, bam, we clear out, we start over. We do that constantly. We are releasing, our release process is, it's supposed to be a week, but I'm super naughty, and I do 2 or 3 times a week. I'm just tweaking and changing things, and A/B testing and different things, and making sure that the customers are happy. Which is another good point, if I may. The
Sure.
analytics that we get from the platform, it's really, really, really cool. It's really cool. The ability to see what the conversation is and what are the users, how they interact with it, and all of that. It's really, really cool. It's an unsung hero, really.
Very, very, very interesting. Yeah, I think that we could compare Lanebot as a chatbot builder with other providers, just like a regular company compares to a startup. Like instead of doing one deploy per month or per quarter, we do like 2, 3 deploys per week, and that's exactly the essence of Lanebot, and being super, super lean as a tool, and iterating the flow. I'm working right now on some flows for our own sales processes, for instance, and I believe we're changing it like every single day. We just analyze the data, suggesting the different changes, and we just iterate it, and it works better and better and better. So I think that's a super, super interesting part. And also something you mentioned, that switch from a rail-based chatbot with Landbot right now to the AI part or the NLP part with Dialogflow, and then going back. I think that's super interesting because many people, I don't know if you agree with these, but they got this idea that the ultimate technology every single company needs is actually artificial intelligence related, like NLP, NLU, machine learning, deep learning, and that's the point where they need to be. And I think that at Landbot, we've always positioned ourselves as give your users whatever they need. If they don't need a super high tech engine to understand what they're saying, just provide them with 2 buttons they can choose from, and that's the easiest and cleanest user experience you can have. If you feel like you can add more value with other technologies like natural language processing, then you can move them to the next step. But I love how you take them back in case they are not ready, or they're not the right person or the right moment to change anything with that artificial intelligence or NLP engine, and then go back to Landbot to keep adding value to that user, because that specific moment with that specific person, it's what it needs to be, right? And I think that's super interesting. Not being blind by AI. I need to my chatbot to to pretend it's a human. I don't want anybody to realize they're talking to a machine. No, I want to add value. And if that value means open text questions, that's great. If it means buttons or carousels or whatever, then that's fine, right?
That's absolutely right. And there's a few things there. One of it is, when we started analyzing what people were saying, when we were just throwing them into Dialogflow, you may probably imagine this. The biggest question we found, like something 60% of the times, was they would start the chat and say, "What can you do?" Or ask a random question that the NLP NLU wouldn't understand, and they would say, "Okay, so what can you do?" So we, I'm huge in 2 things. One is human-centered design, and 2 is social impact, right? So if I have a tool that I know has the potential to help you manage a condition that is life-threatening, but I'm just putting it in front of you without you knowing what can you do with it, or what you can do with it, it's just a silly proposition, right? So it's a lot better for me to say, it's not that you, Mr. User, are not ready for this. It's the other way around. We can, and I had this conversation with a lot of people, and it's quite controversial, but I don't necessarily believe that we are ready for AI as artificial intelligence. I think that we are ready for augmented intelligence. I think we're ready for this stage where you can come to our platform and ask a question about what's insulin and what it does to my body. And when it gets too complicated, you're very much free to say, hey, I actually need to talk to a doctor, and we will help you put an appointment with your doctor, at least here in New Zealand. And it's something that I think is very important to understand as a product development manager. It's very important to understand when to say no and when to say it's a shiny technology that everybody wants to use. AI, you mentioned them all. AI, ML, deep learning, NLU, NLP, data science. I can give you like 1,000 names.
Yeah.
But if the end user gets no value out of it, what's the point? Right?
Exactly.
So I think there has to be a balance between, we want to use NLP and NLU. We want users to feel the conversation. We also want them to know that they're not talking to a person. We want them to know that it's an artificial entity that they're talking to, and we mention that all across our platform and all across our conversation, because we're not here to replace anyone. We're not here to replace doctors. We're not here to replace nurses or anything. We're here to augment the ability that they have to see many people. A doctor can only talk to you for so many minutes a day and can see so many patients a day. And a nurse can have an issue at home and be moody. Or when you call a health line, someone on the other side can be moody. Well, artificial entities will never have that problem, right? So we can serve 24/7 the same experience, delight our customers thanks to that. And a huge instrumental part of that is the front end and what are we using for our users to see, to interact with, and that's where Landbot fits in quite nicely for us.
Yeah, that's I mean, we could be speaking about all that for hours. I think you touched a very interesting point, and it's expectations, right? I think that we experienced this ourselves at the very beginning of building chatbots, because our company was founded in 2015, but we started playing around with chatbots in late 2016. And I remember that for the very first versions we launched, everybody was trying to fool the chatbot. Everybody was trying to get a funny response, like to break the flow. That was their main. I mean, everyone was, "What's your name?" And we would get an insult, and that was every single time. And I think that the trend just evolved, and people started understanding, and we as chatbot providers also, that it's all about setting expectations. If you start a conversation with the chatbot and the chatbot tells you, "Hi, my name is John. I'm here to help you. How can I?" Then, I mean, your expectations are super low. You may want to make some more money. You may want to improve your health. You may want to get fit. I don't know, but that's probably not going to work. So if you set the expectations right from the very beginning, just like you said, like, I am not a person. I'm just here to help you out, and this is what I can do. If you want to do something else, I'll probably not be able to help you. And that's when all those takeoffs routes can happen to derivate the conversation to a different person, to a human person. So yeah, that's expectations is a big deal when it comes to chatbots, and I think it's super important to keep it under control. Otherwise, it doesn't really matter how great your experience is. It can be a 9. But if people are expecting a 10, they're going to probably feel frustrated, right?
That's absolutely right. And I think we can read 1,000 books on conversation, because now all of a sudden, if you look on Amazon and those places, you'll find hundreds of books on how to write conversational chatbots and conversational AI and whatnot. But going back to your iteration conversation before, if you follow all of the rules that you need to follow for conversational AI, that doesn't mean that your customer is going to end up liking it, right? And it goes back to the expectations that you're talking about. B, this idea of what am I supposed to do with this chatbot that I have in front of me? And ultimately, what is it that I want to do? What do the user actually want? Are you actually solving a problem that people have? Because maybe people don't want to, ask certain questions. Maybe they just want buttons to tell them what to ask. I think there's a huge element of human-centered design there that needs to be taking place. And there's a maturity that startups thinking about chat, or big companies thinking about chatbots and conversations, need to go through to understand that. It's really easy to create a very rich in features chatbot that will help no one. And it's really hard to do something really simple that actually has the potential to help a lot of people.
And that's way better in my opinion. Yeah, super interesting. I think that chatbots just went from, everybody understood chatbots as the end. It's just a mean, and not even a mean for every single case. Like ourselves, we were so in love with chatbots that, I mean, for the first 18 months of Landbot, our whole website was a Landbot. And we wanted to use the chatbot everywhere. Like, it doesn't really matter if we're talking about support processes, sales processes, I mean, investor updates. We wanted to use a chatbot for everything. And then we realized that, well, there are different interfaces. I mean, the most important thing is to keep it natural, to add value to the user, and to control their expectations. If it has to be a form, I mean, we are obviously against forms somehow. I mean, we probably got some competitors that are mainly form providers. But at the same time, if a form works better, just use it. I mean, it wouldn't make sense to have our platform sign up page with a Landbot. I mean, with a chatbot, it's probably better to just have a form. And I think that understanding that the chatbot is just a mean to get faster or to get better to an end, and not the end as we used to believe a couple of years ago. I think that's also bringing more maturity, like you said, to the whole ecosystem, and people are starting to realize that it's not a trend. It's not something you can. I mean, it's not Siri and Google. I mean, it's not about just asking silly questions to artificial intelligence and see what their response is like. It's about taking the most out of about the most natural way of conversating. And I think that the whole conversational thing, you mentioned that at the beginning, in your case, is really a difference between other solutions. You feel like the information you're receiving is just for you. You feel that privacy, you feel that empathy with that artificial entity you're talking to, and that drives conversion. For a regular business, conversion is probably getting a lead or getting a new customer. In your case, conversion means helping, right? Helping people understand what they're going through and how they can best approach that situation they're into.
That's absolutely right. And when we map our outcome, so we always start with the outcome of the conversation. We want to know at the end of this interaction, as everybody does, it's not just us. At the end of this, what is the outcome? Is the user going to walk away with? And it's always been for us. So let me give you an example. So injecting insulin, for example, we could have said when people come to the bot and say, I want to learn how to inject insulin. I could have given them a huge answer from Dialogflow, and that would have been super easy. It's just literally a copy paste from manuals, right, or from the hospital. Now we decided to take this approach that I was telling you before, take him out of the Dialogflow flow and bring them to Landbot, so we can give them a step-by-step and say, when you're ready, click next, and so on. Granted, you can do that with Dialogflow as well, but imagine the amount of code and the amount of development that you would need, when all I had to do, and all my team, really, I didn't do much, but all that my team had to do was just map that conversation and say step 1, 2, 3, 4, 5, 6, and 7, and put a next button in each one of those boxes. So it's super simple. And at the end of the conversation, which is what you mentioned, what conversion is for us. Conversion for us is a mom or a dad or or a teacher or a caregiver that had a question, and at the end of it, they go, I feel confident that the answer that I got is not only the right one, but also is going to allow me to help the kid that I have in front of me. And again, it's just all about. Always our target was caregivers more than anything else. Patients, and particularly children, are quite supported by health systems around the world. But there are a lot of studies and research around how parents and caregivers get early signs of PTSD when they go through the initial phases of a diagnosis. So we wanted to ease that using tools like this that would allow you to, at the end of it, say, you know what, actually, I trust this answer. This sounds okay, because they're also giving me the source of the information. So, yep, seems legit.
Absolutely, and that's it's a beautiful use case, and we love being part, at least a very small part of this big engine that's actually trying to make the world a better place. So we're super proud of working with you guys, and I would like to hear now, like, what your next plans are, like where you are now and where do you see Kumanu, but also the way you use Lanebot in the next 3 to 6 months, if it's something possible to say. What do you have in mind?
Um, yes, I could. I could talk for an hour on what we actually want to do. I think the next step for us, the very obvious next step, is personalization. Today, our vision was always that the information should be free. Otherwise we'll be competing with Google of the world, and we wouldn't want to do that anyways. So personalization will be the next step to allows us um, to give the end user information that today they don't have by asking a question to Google. Things like, what's my trend for the last 6 months on glucose and things like that, right? Or what's my insulin usage? So that would be number one. However, because I am a huge believer in early prototyping and what I call eternal prototyping, we're always changing that, and we're always changing the idea, and we're never changing the vision and the goal that we want to, and the outcome that we want for the world, but we're always changing how we want to do it. So today is this conversation that we are having, but tomorrow might be Landbot only buttons that would allow people to calculate carbs, and that's it, because we found that that's the one thing that would allow us to change people behavior in terms of type 2 diabetes, and that would allow us to get less people being sick. So because I believe in that, is really hard. But like I said, 6 to 12 months was always very clear to us, to business-wise, to white label the solution and to integrate it into different places, like institutions and health lines and things like that. Then integration is the next big step. The ability to create a flow that would allow us to, for example, have people ordering insulin from their houses in situations like lockdown, like now, for risk groups and things like that. That's the next step as well. And to your question around how Landbot fits, Landbot is our front end, and that's not going to change. Landbot allowed us to go from a very clunky prototype to a proper minimum viable product that we're very, very proud of showing people, and people who use it are delighted with the whole front end. And we're going to keep changing the way that we interact with users, but that front end is definitely not going to change. And the ability that we have to integrate with different providers from Landbot, use it as a command center for everything we do. It's just really vital for us. If we wanted tomorrow to stop using Dialogflow and started using Microsoft Assistant, for example, granted, we would have to write code from then on, because there's no native integration. But regardless of that, it would allow us to do that without changing the front end, without changing what the user sees every day, and without having to restart and recode the whole process. So that's where we fit. Now, to finish the answer, long time in the future, I see what I like to call digital avatars. I see KumanuCare being part of reaching out to the regions of New Zealand, particularly, and other places of the world, We are talking with people in Spain. We're talking with people in the United States to get a global reach. But initially, in the regions where doctors are not don't have enough presence, where we have indigenous communities that they get together in Marais. Marais is sort of like the house of each of the tribes. We see a platform where you could either ask, use your voice to ask these questions, or to have a digital avatar in this Marais to answer questions, and for any of all of those people to feel represented there, and to have, not only for diabetes, but for many other chronic illnesses. So the ability that NLP and NLU gives us is that we can plug other illnesses in a relatively simple way and keep answering questions that's changing the label of the condition that we're helping with or for. So that's the future for us.
Well,
fingers crossed, 24 months or so.
Yeah, it's a very, it's both ambitious and inspirational roadmap, and I love to hear that. Yeah, you mentioned a lot of things I would like to make comments about, but I think I'm just gonna jump into the last part of these podcasts. And yeah, I wanted to tell you, I mean, when you mentioned about Dialogflow being a native integration, the reality is that at the beginning it was not. It was just a brick, and that brick contained a couple of webhooks to send the information back and forth from Landbot to Dialogflow to be analyzed. And I think that's one of the interesting things about Landbot too, and what's going to come in the next few months. So we are going to work on a lot of pre-integrations that are way faster to develop, and the best part is that they can be built with our own product. And that's something that will come in the next weeks. We're planning some big launch very, very soon. That's going to include great features we're working on, like Lanebot 3, for instance. If you're using us for the front end, I'm pretty sure you'll fall in love with the new interface of Landbot and how flexible it is. So yeah, we are super excited to keep growing together and help you well with all those challenges that are super, super interesting and really, really worth it. So yeah, just jumping into the last part of the interview, just 3 really quick questions that we ask all of our guests. And the first one is, what's your favorite feature in Landbot? Like, if you would have to pick just one, it can be anything, like a section, a block, a break, whatever. Like, what's the feature you tested and said, wow, this is definitely it?
Aside from the Dialogflow integration, we wouldn't be having this conversation without it. I think that the brick is the one that we use the most, because the combination between the brick and the conditionals, the conditions that we can use, right? So we can get from Dialogflow parse a custom payload, and that payload is compared to a condition, and then that sends the conversation onto a brick. And because we have the ability to have that brick created and have another full conversation in there, it not only keeps it all tidy, but also allows me to get it from one particular bot and move it or copy it to another one using templates, and iterate different versions of the same bot or the same product over and over for different things. And a good example of that is we're doing A/B testing for the carbohydrates right now, and we did that all based on bricks.
Wow, that's very interesting. Yeah, bricks is probably one of my personal favorites, and I'm happy to say that we're going to give it a twist, a very, very interesting twist to make it more usable, to make it more powerful, and that's going to come with the launch I was telling you about. That's going to happen in the next weeks. So yeah, bricks is definitely.
Me now.
Yeah, I mean, I can't share much, but I can tell you that it will be like easier to reuse, easier to share, not only within your own account, and more powerful when it comes to pre-built bricks. We're gonna even add a subtitle to those breaks, but yeah, in the next weeks you'll be able to know more, and know for sure you'll be one of the best beta testers. So the next question would be, what would you like to see in Landbot? Like, we got a lot of features, but there's definitely a lot missing. Like, what is there anything you said, if they would have these, that would be amazing? It can be a feature iteration, it can be anything.
I have like a gazillion things that I could dream of. Not because Landbot is missing them, but because I'm crazy. Well, I would say that a tighter integration with databases would be one thing that I would really like to see.
Mm-hmm.
What I mean by that is I would like to be able to use, for example, say Firebase from Google Cloud
Mm-hmm.
natively, and just being able to pull data from there or to save data from there. So that's one of the things that I've found that I would really like to use, just to avoid
Mm-hmm.
using APIs, right? Because today
Yeah.
we could create APIs ourselves and things like that. We have been avoiding that for quite a bit, waiting to see if there was an integration coming. So that would be number one. Number two would be a way for us, and this is very, very weird dreaming of mine, a weird for users like us when they start the journey to
Mm-hmm.
create a login for their users that would somehow talk to, again, integration with a database that would allow you
Mm-hmm.
to have a full turnkey solution from Landbot, if you know what I mean. So
Mm-hmm.
where
Mm-hmm. Yeah.
where you could just deploy it and say, yep, you can sign up your users here, and then every time they come back, they sign in, and all that information is saved here, and you can pull all the data in those fields by using this webhook, or not even a webhook, this other integration. So it's just making more an ecosystem for
Mm-hmm.
end users, and less a conversion type of thing, if that makes sense.
Mm-hmm. Yeah, it does. It does. It's actually super interesting. I think the whole authentication topic is very, very hot within Lanebot right now. Probably there's a workaround. Well, a very, a workaround for that now is just what some customers do is just ask for their email. Then you match that email with your database and you get all the info. But definitely, I completely agree with you that having some way to unify all your experiences so users are instantly with all the context you have from them, so they don't even need to, just a couple of clicks and they're in, you know who they are, what they've been through over the past few weeks with your different experiences or chatbots. And yeah, that would be great. That would be great. And I
That that
think, yeah, that we're going to work not exactly in that direction, but close to it with, trying to adapt sign up and sign in processes within Lanebot. That's probably going to take time, but it's super interesting, and I'm pretty sure the product team has that in mind and it's been for a while.
I think it would be a not only a game changer, but also it would change the way that you interact initially. Because, like I said, it's a turnkey, and yes, there are workarounds that we can use. We could use
Hmm.
sheets and things like that, but
Yeah,
because we deal with medical data, we need to be very
absolutely.
mindful of that. First of all, so it's there's a bit of that. What we are doing actually is we have a before jumping into the Landbot itself, we have
Hmm.
a sign up, sign in webpage before that works sort of
Hmm.
like as a firewall between the user and
Hmm.
the
Interesting.
conversation that is integrated. Yeah.
Hmm. Hmm. Yeah, great workaround. All right, Diego, last but not least, which advice would you give to newcomers, to people that are just starting out with Lanebot, or maybe they're already, premium users, but they just don't fully understand what they can do with it? How should they start? Like, what would you recommend for someone that's discovering Lanebot just now?
Yep. Um, Facebook community would be one of the things that I would say. There are really
Mm-hmm.
helpful people out there, and Jackie is there all the time asking questions and answering as well, which is really cool to see. So that
Mm-hmm.
would be number one. So rely on the community. Number two, ask the chat. The chat support is unbelievably good, unbelievably good, and they have answered questions all around. Like I had simple questions and stupid questions and complicated questions. They always with a what I believe is a smile on their faces. They always answered those things. And three would be iterate and try. Try, 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 try. There's no as far as I'm aware, and you correct me if I'm wrong, but there's no charge for you creating and deleting bots. So just try
Exactly.
one, you don't like it, start over, and duplicate it and start over, and try it with different colors and try it with different things. It's like a million opportunities out there. And I think, like I said, we tried at least 10 to 15 platforms. No single one stacked up as easy to iterate as yours did.
Wow, that's a big statement. Thanks for that, Diego. I think it's a great piece of advice for newcomers. So the last thing I wanted to ask you is if people are listening to us and they feel like they feel engaged with what Kumanu is doing for people, like how should they reach out to you? How they can take advantage of what you're offering? How should they find Kumanu if they're interested in knowing more about your initiative?
Absolutely. So you can go to www.KumanuCare.com. You can search for us on Facebook, on Instagram, or LinkedIn as KumanuCare. And I'm always available, man. I'm always available to answer any questions. I understand that medical and health data and information is very tricky. It's very valuable for people, and like I said, because we're not trying to replace any professional physicians or anything here. We come from the goodness of our hearts, trying to help people. So just come and visit us to any of those websites. You can talk to our bot, which name is Gigi. You can talk to Gigi. On Facebook, you can talk to it on our website. Our preferred place is the website because of the user experience. Just come and talk to it and see how you feel, and send us an email at info@kumanucare.com if you have any questions. More than happy to be there.
Great. I really hope you guys keep pushing the way you're doing so far and helping so many people. And again, I feel really honored. I mean, we work with a lot of customers, with a lot of users, but when you get to to discover these initiatives that are again, it sounds like a topic, but making the world a better place, and that's just exciting. I mean, honestly, it's super exciting, and as a co-founder, I'm really honored to be working with you guys. If there's any special last message, Diego, you want to share with the audience, I'll be happy to hear it.
Thank you. Yes, I would say there's 450 million people in the world with diabetes, and 500,000 are diagnosed a year in the United States alone, and there's a growth of 20 to 25% a year, and that's massive. So I would say that when you see these type of initiatives, just support them and just reach out and give us a hand, just even if it is by trying out the bot and saying, it's good, or no, it's crap, you need to redo it. We'd be more than happy to hear that. That's one thing. And the other thing is, let's not undervalue the fact that there are other companies like yours who are always there to lend a hand and to do things like this, which is to bring us to a special light and to help us bring the value to more people just by the sheer broadcasting of what we do. So thank you so very much for helping us.
It's a pleasure, and it's been a pleasure this whole conversation. We could have spent like a couple of years probably talking about eternal prototyping and other topics, but it's been super interesting. I really hope the audience is enjoying it or has enjoyed it yet too. And thank you very much, Diego. I really hope we stay in touch. We would love to know everything about where Kumanu is moving forward, and we'll be there to support you guys.
Thank you so much. Thank you for your time.
Thank you. Bye, everyone. See you in the next customer story.